Welcome to The Big Picture. I'm Phil Arno. This week on The Big Picture, we're going to talk about eyesight. Today in America, our eyes aren't doing so well. As a matter of fact, a recent study showed that 61% of Americans now use glasses or contacts. We've especially taken a hit when it comes to our distance vision. According to the National Institute of Health, in 1971, 25% of Americans were nearsighted. In other words, they couldn't see distant objects that clearly. Today, the figure is up to 42%. Why? Well, a lot of eye problems are just plain old genetics. Blame mom and dad. But that doesn't explain the increases. But no, there's a simple explanation. I can remember when I was a kid, my mom yelling at me, "Don't sit so close to the TV set. You'll ruin your eyesight." Today, of course, this is what we're dealing with. We all know it. We're all guilty of it, especially the young ones. Admit it. Your kids, your grandkids, everybody's on a tiny screen. Everyone. I realized the world had changed a few years ago. When I was on a trip and my wife was sitting next to me, she picked up her phone and answered a call. It was from the kids in the back seat asking when we were going to stop for lunch. Let's face it, the world is now a close-up electronic experience, and that's not going to change. So more and more, we're all going to be needing glasses or contacts, more of us anyway. That'll be a regular routine for us during the day, each and every day. Either you, A, put your glasses on and be very careful during the day, or B, put your contacts in first thing in the morning. Make sure you take them out before you go to bed, or else. Those are the only choices short of surgery, right? No, maybe not. What if I were to tell you that even if you have really bad eyesight, there might be a way for you to walk around all day with no glasses or no contacts, nothing at all in or on your eyes, and you still might be able to see as clear as day with no correction? Well, my guest today is here to tell us just that. Dr. Michael Murphy, who is with the Clarence Eye Center, has been helping people in Western New York see clearly for more than 25 years. Welcome to The Big Picture, Dr. Murphy.
Thanks for having me, Phil.
Pleasure to talk to you. And you know, the technology, kind of a select few physicians throughout the country use this technology. There's a contact lens that you work with that people wear at night that basically forms your eyes so that during the course of the day, for 12 to 18 hours, your eye is formed so that your eyesight is clear for that amount of time, so you don't have to wear glasses or contacts. Can you explain a little bit about that technology?
It's exciting technology. It's actually technology that's been around for over a decade. It's something that my kids have done for several years. It's something that one of my late partners had done with his kids for several years. And it still amazes me today that kids can go to sleep with a customized contact lens on their eye, gently reshape their cornea, which is that tissue right on the front where you would normally place a soft contact lens during the day, reshape their vision while they're sleeping, and then give them the freedom to not have to wear glasses or contacts in their waking hours.
And it's something that normally, if you weren't doing this, they'd be wearing glasses or they'd be wearing contacts. Is there any more difficulty or less difficulty, any drawbacks to using this kind of technology?
The technology has been proven to be safe. It's been approved by the FDA for every age level. There's no restriction on age. There is a little hand-holding by mom and dad in the beginning, but actually parents kind of like that because they get to oversee their children while they're learning the process. So it is a little more work early on, but it's worth the effort.
So, you know, during the day, you don't have to worry about losing contacts, and you don't have to worry about, kids being, self-conscious about wearing glasses. It's kind of an interesting technology.
It really gives kids the freedom. If they're active in sports or they like to swim, you don't have to worry about them losing a contact lens. You don't have to worry about them losing their glasses or their glasses fogging up. So I think the freedom part of this technology is what's reassuring for kids and for parents.
Are people surprised when they hear about this technology? I hadn't heard about it until, we talked, some time ago.
Parents, when they hear about it the first time, they're like, I've never heard of this. Is this real? Is this possible? And, after a little education and sending patients home with some information, a lot of patients are excited to do it.
That's interesting. I don't think, as far as I know, there's anybody else in Western New York that does this. I'm not sure. Are you aware of any other?
I'm not aware of any other practices in the area that do it. I do think that would be good if other practices did step up and offer this technology. I do think that all boats rise with the tide, and bringing more awareness to myopia and nearsightedness and how we can slow this progression down based on what you had mentioned earlier in your segment is an important thing that we have to tackle as an optometric community.
Mm-hmm. How does the cost of technology like this compare with other regular contacts, for instance?
There is more upfront cost. There is more commitment on that end. Every case is different, and we're happy to sit down with parents and patients and explain those differences. But there is a cost difference compared to a regular contact lens. But it is a customized product that's formulated just for your kid's needs.
And if I remember correctly, when you get a set of contacts, they last for about 6 months, right? You don't change contacts every day or every week.
These lenses should be replaced every 1 to 3 years, depending on how well they're maintained. The labs would tell you to change them every year. If patients are taking very good care of them, we're seeing our patients every 6 months to inspect the lens, inspect the health of the eyes, take maps of the cornea to make sure everything's functioning the way it should be.
And is there a particular age that's more appropriate for this than, is it mostly just kids? And how early can you do this? Can adults do it?
Most of our patients are children, and it's because of this epidemic that you touched on earlier again. Our kids are becoming more myopic, and while we give kids the freedom of not having to wear glasses or contacts during the day, one of the side benefits of this technology is it can slow myopia, nearsighted progression down, and that can slow the rate by about 50 to 80%, which is tremendous.
That's a really good side benefit. I mean, if in the long term, it helps you avoid the worsening effect of myopia.
You had talked about the 25 or 26% rate of myopia in the 70s, and that number is up to 42 or 43% today. And it's a factor of our kids being indoors, they're on their devices, they're not getting outdoor time. The studies are saying our kids really should be outside 3 hours a day before they need glasses. Once they start to need glasses, once they're in that myopia progression, there's not a lot that we can do to slow it down other than a technology like this.
When I said my mom used to warn me about getting too close to the TV set, I didn't realize she knew what she was talking about. If you tend to look at things very close for long periods of time, your eyes really get used to that close-up vision, and that's what makes your long distance vision not so good, right?
That's part of it, and then genetics too. We have parents that are both nearsighted having nearsighted kids. And so we're trying to figure out the exact mechanism by which all of this happens, but the trend is there. The epidemic is there. In Asia, myopia is up to 80 or 90%. So we do need to slow this progression down. There are health concerns that we have as an eye care community that can occur in our older years: glaucoma, retinal detachment, cataracts, macular degeneration. All of these risk factors go up the more nearsighted we become.
Well, that's interesting. In general, you've been practicing now for close to 25 years. Do you see a trend in the health of eyes and eyesight over the course of that time? Is there, other than what we've just talked about with kids and the because of the screen time, is there a general direction that eye health is going in?
Well, the risk of these conditions is getting worse because of myopia. We are getting better as a community of diagnosing these conditions earlier because we have newer technology in our office to diagnose these things. But one of the biggest health concerns that's going to face us over the next several decades is myopia, and no one really thinks about it. People think, I can just go to my doctor and just get stronger glasses. But they don't think about the fact that, you know, the eyeball is actually elongating. And when everything in the back of the eye starts to stretch and elongate, that's when you can run into these other health concerns, the macular degeneration, the glaucoma, the retinal detachments. And those are visual debilitating concerns that can really affect people's everyday life, their work style, you know, what they're able to accomplish during the day.
There's so many medical advancements due to research and technology and just the field of medical studies that, you know, have really had breakthroughs in the last generation or two. Is that the case with eyesight as well, and the study of eye health? Has there been a lot of advancement in technology and the study of, like you said, you're trying to figure out certain things about the causes and so on? Has there been a lot of advancement in this field? Absolutely.
I mean, we're in the information age right now. We get bombarded with medical journals and new information, new technology, and I love it. You know, it's helping me take care of my patients better and better every day. I want to offer my patients the best technology, the most cutting technology that's out there. So yeah, the eye care field is moving at a rapid rate.
I know the surgeries that have come along that were a little bit rare maybe 10 years ago with, you know, radial, what is it?
Radial keratotomy was very barbaric when you look back at it now.
That was very new, and now it's almost like a very, very common, almost.
The newest one is LASIK, and now surgeons are using all lasers cataract surgery. So in the surgical field of ophthalmology and eye care, you're seeing a lot of advancements in the use of lasers to make these procedures safer and more precise and give patients better visual outcomes. And those are things that we talk about with all of our patients that come in for exams.
Okay. Well, when we come back in the next segment, we're going to talk about some of the myths and some of the changes in fashion and just a generic conversation of eye health and you know, where we're going in today's society with eye care. We'll be back right after these messages.